Good morning, everyone. Doc Dave here, and today I have episode number 24, and this is tailored towards my female audience. It's on menopause. Yes, that dreaded menopause. First thing you need to know about menopause, it is a natural process. It's not a disease. Every woman goes through it. So, with that being said, what is the definition of menopause? Well, it's a natural decline in the reproductive hormones, your estrogen and your progesterone, when the female usually reaches in her mid to late 40s to her mid to late 50s. Now, how do you diagnose this at home? Well, usually about 6 months before the onset of menopause, you start to get a decrease in the blood flow of your period, and you get a decreased duration of the period. That's kind of the little warning sign that menopause is coming on. And then the formal definition is you have no menstrual periods for 1 year. Then you know you're in menopause. Now, you're not able to get pregnant during menopause because you don't have the reproductive hormones. So that's something to understand. It's very rare even for females to get pregnant after 50 years of age. And the oldest documented menstrual period in a female is at age 57. Now, how long does it last for? Well, I hate to say it, but it does last a while. Usually 2 to 3 years the symptoms will last for. And there are ways to kind of temper this down during that period, and we'll go over that in more detail later. So, the process of menopause, like I said earlier, it's a natural process, not a disease. People have to understand that. It's when women's ovaries stop producing eggs, and the production of women's reproductive hormones are decreasing. So, you've got this thing called a follicular stimulating hormone that generally stimulates the ovaries to release eggs during your menstrual cycle. And the hormones are now decreased, so you don't get egg production from your ovaries. So, what are the symptoms? Well, it's pretty straightforward if you've been through menopause, or if your mother's been through menopause, you can kind of ask her ahead of time. But I'll explain the symptoms that are documented in the past for women going through menopause. The first one and the most common one is hot flashes. Now, what are hot flashes? Well, actually, it's a brief periodic increase in body temperature. So your temperature is actually going up. It's not like you're just feeling hot flashes, but you actually have an increase in your body temperature. And you get flushes with this. And this is found in 75 to 80% of the women. So you got a good chance you're going to go through this. Now, other symptoms, night sweats, trouble breathing, trouble sleeping. Okay, you get insomnia, can't get a good night's sleep. You get arthralgias and myalgias, which are pains in your joints and in your muscles. You get a discomfort during sex because your vaginal tissue is thinning out and it is drying out. You get mood swings, oh boy, anxiety and depression, both, occurring. You're going to have days where you feel anxious and you're going to have days where you feel depressed. So you got to kind of be prepared for that. You get irritability. Yes, we all know that. And, it's just something that you have to accept, and people around you have to accept. And, they have to support you, and there needs to be a good line of communication, especially with your husband. You get palpitations. Your heart starts to flutter a bit. Yes, and you also get forgetfulness. You're not going through dementia, but you just get forgetfulness. And you get the dreaded weight gain. So, how do you prepare? How do you try to symptomatically treat these symptoms? Well, there's no medical treatment except for the doctor maybe putting you on a birth control pill to try to regulate your hormones a little bit. But we'll go into that in more detail. But there's something called green tea. Green tea does help resolve a fair amount of these symptoms. So if you haven't developed a taste for green tea, this is the time to do it. Also some vitamins, which I'll go into in a few minutes as well. Now, diagnosis. How do you diagnose this? Well, first of all, like I said earlier, no period for 12 months. The doctor can draw a blood test and see if there's an increase in that FSH I mentioned earlier, the follicle stimulating hormone, because the hormone is trying to stimulate the follicles to put out eggs, but there's no further egg production, so the hormone level goes up as it tries to produce the eggs, which are no longer being released by the ovary. So, and obviously symptoms. So what kind of complications do you get from menopause? What kind of medical complications? And some of these are pretty serious, so take this to heart, what I'm going to say. And a little play on words, because the most common one is heart disease. You get a heart disease from menopause, and usually it's because you have a sedentary lifestyle. You don't have the motivation to go out and exercise. Your diet kind of changes, you eat stuff that you shouldn't be eating, fatty foods, that's going to increase your cholesterols and stuff like that. So the best way to prevent heart disease during menopause, obviously, is to go out and stay active and get some exercise. Watch your diet, eat healthy foods, manage your stress as well as you can, and keep your social connection so that you're active and out moving around and doing things. Also, avoid or decrease alcohol and stop smoking. Now, you get bladder symptoms. You get increase in bladder infections, okay? And you get vaginal dryness. And you get thinning of the skin on your face, so your wrinkles are going to become more prominent. Those are things you need to know. And your fatigue and your motivation kind of declines. So, it's sad to say, but it's documented that 60% of the divorces happen during menopause. So be prepared, and that's what I said earlier. Have a good line of communication with your husband. Talk things through. Get him to support you. So, treatments. Well, like I said, the only medical treatment is that doctor can put you on birth control pills to try to regulate or supplement some of your estrogens and progesterones. But I'll let him discuss that with you. Your gynecologist will be a specialist in discussing these pills and trying to dial in the right amount of estrogen and the right amount of progesterone. So you can connect with your gynecologist on that. Now, other things that you can do, which I mentioned earlier, green tea and vitamin B help decrease the symptoms. So those are supplements that you can take at home. And vitamin B12. And that decreases your fatigue and your mental loss. So that's something to supplement as well. And the good source for vitamin B12, you don't have to go to one of these vitamin B12 centers and get a shot every month, is meat, beef, and pork. So something nice to know. Vitamin D is a good supplement to have because it increases bone strength, because otherwise you get a little bit of washout in your bones, which is called osteopenia. And you want to supplement that because you need the vitamin D to absorb the calcium in your diet when the calcium strengthens your bones. Iron supplements are good because you do get a little anemic during menopause as well, and it'll help prevent and correct that anemia. Magnesium is a good vitamin supplement to take because it increases muscle strength. And citrus fruits, as well as apples and bananas, are thought to be helpful. Okay, so what is the differential diagnosis? Now you're going through menopause, you assume it's menopause that's giving you all these symptoms, but there's other things you got to kind of think about. You can't, it's not 100%. It's not all or none menopause. One of them is Pregnancy, no menstrual periods. Okay, you got to make sure, you're only in your mid-40s, you're still active, and you can become pregnant in your mid-40s to late 40s. So, do a pregnancy test, don't assume it's menopause, and make sure that that's negative. Hyper and hypothyroid is a differential diagnosis. And I won't go into all the details, but have your doctor do a TSH level or a thyroid level on you to make sure that that's okay. Heart disease, which I mentioned earlier, just, take care of your diet, take care of your exercise, stop smoking, stop drinking, and do things that are healthy for your heart. The anemia, that's another differential diagnosis. You're going to feel washed out and fatigued with anemia. So, that's why I told you to supplement your diet with iron. Okay, so there you go. That's menopause in a nutshell. I don't want to get too technical with all the hormones and this, that, and the other, but this is stuff that helps you decide, hey, I'm falling into the group that follows all these symptoms, so I must be going through menopause. So, and things to look for and things to prevent, things to help supplement it and understand menopause in itself. So in conclusion, I just want to mention again, it's a natural process. It happens to every woman. Prepare yourself, communicate, and keep social friends with exercise, good diet, and vitamin supplementation. So there you go. That's your education today on menopause. I'm glad I can, present this to you. And if you like it, hit the like button. I always like likes, and I always like subscriptions. And this is something you can pass around to all your friends in your age group as well. So go ahead and feel free to share it and give it to family members. So there you go. I appreciate your time today, and we'll have another exciting new episode coming up very shortly. So signing off, Doc Dave. Remember, I am your friend, but I am not your doctor. Okay, have a good day.